Well, you guys, hello everyone, and welcome to another Facebook Live and Instagram. Well, we're not doing Instagram today, actually, YouTube Live, and we're gonna repurpose this for Instagram. But I want to thank you for being through this month of October with us. And, here we are talking about breast health. As many of you know, it's labeled as the Breast Cancer Awareness Month. I have a challenge with that name because I think we are very well aware that breast cancer is a problem. It is prevalent, and what we are not really discussing enough in any of the mainstream media or pink ribbons or whatever you want to look at some of the nonprofits, is really talking about prevention. What can we do to prevent or early detection of breast cancer? So mammograms are not it. There is not enough conversation about nutrition, detoxification, hormonal balance that really helps to, really prevent and manage our breast health in a meaningful way. So as part of our this month's lineup for content, we've got a very special guest here today, Dr. Rind, Dr. Bruce Rind. Hello, Dr. Rind.
Hi.
So good to see you. He's in Maryland, and he is in private practice. We'll talk a little bit about his practice a little bit later on, but I just want to first of all acknowledge the fact that Happy Sisters, the product that we have, Happy Sisters, was developed largely, or I should say the instructions for how to massage the breast was inspired by Dr. Rind. He was the one who really, who taught an amazing practitioner called Gay Walden, who is in North Carolina. So for those of you ladies who want to have a private consult with someone who really understands breast health and want to get a thermography, she's in Charlotte, North Carolina. She was the one who told me about Dr. Rind. So Dr. Rind, your instructions on how to massage the breast has inspired my product, Happy Sisters. And so all of you who have Happy Sisters and you received the little standee that you put on your bathroom counter to learn how to massage, to do a lymphatic opening of the breast, that is Dr. Rind behind it. So I want to thank you for that inspiration and for that education. So let's talk about thermography today. And I first off, I just want to kind of set the stage here for this conversation. This is not about us dissing mammograms. This is not about us saying that mammograms should never be done. This is really about really educating you on a difference between thermography and mammograms. It's a very different technology. There's a very different purpose of it. And that's what Dr. Rind is going to really give us a lot of education on today, because I really dislike those, polarizing conversations where people are having arguments with each other of which one is the right one, which one is the wrong one, why thermography is useless. And then here comes the mammogram proponents or women who had breast cancer before, and I've received a number of emails that were very angry about that. What you will learn from this conversation today is the differences are significant. It's not one or the other. They have completely different functions and roles. You will learn about what a thermogram can tell you about your breast health, and it's really quite fascinating, the things that a thermogram can pick up. You will learn about what are some of the providers that you want to look for, and in terms of what is a good thermography center versus one that is not a good one. And is unfortunately the bad ones, the poorer ones, is what got thermography quite bad reputation in some of the communities. So, and then we're going to open up for about 15 minutes towards the end for open Q&As with Dr. Rind for you guys to pop your questions. We do have some slides, so we're going to be sharing that as well. Dr. Rind, welcome to the call today. I really appreciate you. I know your video is not your main form of medium of communication. You're in private practice. You're in Maryland. You're still taking patients, correct? You
That's
see
correct.
women on a daily basis. Yeah. Dr. Rind is an MD and a DO. So, so he has a very unique way of looking at the body. And so you will see that through the slides that he's sharing today, how certain adjustments, diet, hormones can really play a big role in the health of your breast. Dr. Rind, why don't we just take it from here? Do you want to just do a little you preface it in any way, or do you want us to jump into the slides? What would you like?
A few words first.
Sure.
So, okay, I agree with everything you just said, and I just wanted to embellish on it a little bit, just to say a few things. you're correct about it's not thermography or mammography. They have different purposes, different jobs, different missions. Sometimes when I have a patient with a high risk, I will absolutely do the mammography. I want to see, is there cancer already there? And thermography, the main use of thermography is it's a functional image, whereas mammography is structural. Structural means the structure has to be there in order for you to see it. If there's no cancer yet, you can't see that. Now, or if it's too small, you can't see it. Functional means the body's behaving in different ways because something is going on, and you could see things coming on before there's a problem. So you could head it off at the pass and say, I'm going to do something about it. Being a sitting duck is not doing something about it.
Yeah.
What you do is you do the, let's say the thermogram, and you say, oh, I have a high risk right over here. What am I going to do? One of the things that you can do is, number one, the lymphatic drainage, which is, a very easy way to, to do that, pick up, go like this, go like that. And very easy. It takes about 20 seconds, then 20 seconds, 20 seconds, again, 20 seconds. We're done. Just like the spokes of a wheel all around, and gently and firmly. Why is that important? Because it'll give lymphatic drainage to the breast. And if you have lumps and bumps, they will very often go away within 2 weeks. The same can be said for the product you were just mentioning, which is the same thing that I use. And I think there's an association there. And I've been using it for 20 years. And what I find is if they just put the same substance on the breast, it stimulates breast lymphatic drainage. And again, very often what I find is lumps will go away. If they have lumpy, bumpy breasts, and they do the lymphatic massage, and hopefully you have somewhere where you can show them, and then apply this, that usually will, or especially at night, then the breasts start draining, and in the morning you do the shower, you do the, different massage, and lumps and bumps, I would say 90-95% of the time, lumpy, bumpy things just go away. And women are told, oh, you have fibrocystic breasts, you need an x-ray, or you need a surgery, or you need this. My philosophy is this: if I can make a lump go away, it's not usually a problem. The problem is when the lump doesn't want to go away, you then have to, because a lot of times it's just lymphatic blockage. The other thing to keep in mind is rib cage has to be functioning well, because that's part of the lymphatic pump when you breathe. I just want to say that. And the summary is thermography is for looking forward at what's coming up ahead. Mammography is looking backwards at what already happened.
Yeah.
If there's a weather report, thermography tells you it's going to rain this week, or it's going to be sunny this week. Mammography tells you it rained last week, and right. Because it can only see things after the fact. Here is the lymphatic. The blue arrows show you the direction of the lymphatics, and so you just follow with your hand wherever that takes you. Okay.
And you guys, this is on our sales page for Happy Sisters, and we've used that on social media and in the past this month extensively. So just look at whether it's the Instagram or Facebook, and you will see how to massage your breast. You can print it out. For those of you who bought the product, you have that little standee that shows you exactly how to do it.
By the way, I haven't used. You sent me a sample. I haven't used it yet, but I'm very much looking forward to seeing how it works, because I'm very familiar with all those products. This is fabulous. Saved me a lot of trouble, a lot of items. Now, next, okay, we can. Next slide.
Do you want us to go over to your slides?
Oh, sure. Yeah, go over to my slides. Yeah.
Okay.
Okay, we'll go. Next. Okay, thermography allows you to see with a camera what your naked eye can't see. Let's go forward, we'll see. Over here, middle picture is what your naked eye sees. Thermography can convert the temperatures into colors or grayscale, and both have a function. The grayscale, as you will see later, helps us to see vascular patterns, and the color helps us to see regions of heat. For example, her right shoulder, you're looking at her back, the right shoulder has some inflammation. You can see a lot of red over there. Okay, and by the way, if you see all the grayscale little dots, the polka dots everywhere, that is typically what happens when you have more estrogen than progesterone, called estrogen dominance. There's a disequilibrium between estrogen and progesterone. If your thermographer is not doing grayscale, just doing color, you're missing half of the information.
So this is, you guys, this is really important, right? Because this is where, you walk into a Botox center that does thermography. Most likely, I'm not dissing all of them, but a lot of them would only do very low quality, poor image, low resolution, and they don't do the black and white. The black and white is one of your tidbits here, pro tips. When you're choosing a thermography center, make sure they do black and white imaging as well.
And the information from the black and white is at least as much as important as the color. You can't say, oh, the color is nicer. Yeah, it may look prettier, but the black and white give you actionable data. So this is basically thermography. It tells you physiologic change. You're looking forward. Interesting thing, in a thermogram, if you have 5 levels of risk, if you're at level 1 or level 2, low risk, if that's how the assessment goes, the statistics are that is a 99% certainty that you do not have cancer, and probably will not have for quite a while. On the other hand, if the thermogram shows a level 5 risk, that's a 90% statistically, 90% likelihood that you have cancer already present, even if it's only 1 cell, 2 cells. When you see a 5, usually there's a good chance we're heading into trouble.
And we're going to be showing you the scale in just a second. That's coming up. Okay, and a mammogram, you want to talk about that? Lets you know.
The mammogram will let you know once it's already present. And it is invasive. Thermography is non-invasive. You get radiation and you get mechanical squishing, trauma. I found that in many cases, I have women that develop problems after the mechanical squishing. They go like that, and then right where the plates were, that's where I can feel the new lumps developing, because the lymphatics were blocked, and if they're inflamed, then this is an unhealthy area. So a lot of people don't think about the health risks of trauma to the breast. That's where I often see problems after trauma. The radiation is one thing, and if I may just say something about radiation, you can prevent problems with both. Radiation, you can block the radiation with vitamin C and quercetin and astaxanthin. If you do those before you go for any radiologic, including flying on an airplane, which is, you go to California, you just had a chest x-ray. So you can block the radiation. There's an experiment done with mice. They gave them enough radiation to x-rays, to kill them. They gave them the vitamin C, high dose vitamin C. It took 4 times as much radiation to kill the mice. In other words, they had a 75% shield. Mm-hmm. If you take that along with quercetin, a bioflavonoid, and then with astaxanthin, you've just multiplied that, and now you have a much, much stronger shield. You don't have to worry about the radiation so much.
How much vitamin C for a human body would that be? Like 2-3 milligrams?
Some people can only tolerate 2 or 3 before they get diarrhea. Other people can tolerate 6 grams. If you take 2 grams before you go to the first test yourself the day before to make sure you don't have diarrhea. You go there. Yeah. But if you could take 2 grams of vitamin C, 1 gram of quercetin, and if you could take any amount of astaxanthin, maybe 5-10 milligrams, then you're very shielded. Now, the quercetin has another benefit, and that is, I found that it prevents trauma to the body. If somebody has a car accident, they're going to be achy and painful for a long time. You take a handful of quercetin now, and maybe a few hours later, you wake up in the morning, you don't feel like you had any problem. In most cases, people feel fine afterwards. So why is that important? You take the quercetin before and after the plates are squishing you, and you probably will not develop any kind of lymphatic blockage or swelling. And also just do use the Happy Sisters and the lymphatic, and
question for you,
will not have any problems. What?
Question for you: what about 3D mammograms? Like, what is that? What is the ratio? What is the rate of radiation that women get from that?
I just spoke to a radiologist about that. He said that the new technology, the new machines are very low radiation, so they could get by with much less. And it still has a lot of radiation, but a lot less than before. And so they don't consider it that big a deal. But if you take your vitamins before you go in there, you have them less. That's
a super great advice. All right, let's talk about the chart.
Now, this is just a chart to show you at the top blue, level 1 risk, green level 2 risk, yellow is 3. And you could see keep going down, down, down like that. And the 5s over here are known cancers that I put down there. And you could see that, well, we'll show you in bigger enlargement. Go ahead, let's next one.
Okay.
So level 1, you could see there are no vessels at the top in the grayscale. And the blue, the heat right and left is roughly equal, and that's pretty good. It's a 1. Okay, now over here, let's take a look at number 4. Number 4 has a blood vessel in the left breast, which is sticking out like a sore thumb. It doesn't belong there. And that tells me that there is a high risk. She's a number 4. The risk was not mathematically high enough to say it's a 5, but it said, hey, look here, make sure that there's nothing developing in this area. You could see the color one, the yellow stripe with the same black stripe is on the left breast. And it just gives you a hint. Now take a look at the armpit in the right here in that same one. And you see that where that little mark is, it happens to have a lot more heat in the armpit, whereas the other one is a normal armpit. It doesn't have so much red. Again, it's a warning. It says, hey, and also look at the total breast. The left is green, whereas the entire right is virtually it's blue. So again, it's warmer. Green is warmer. It's like a rainbow. And that lady needs to be looked at because you don't want to walk around with that and ignore it. But it's a warning, and it lets you know ahead of time, yes, you can do something about it.
And it's like the ones on the left side, like the number 4s and the number 5s, like this is a person who is highly estrogenic, isn't she?
You can look at number 4, the bottom number 4, which is a little darker 4, and you see all the polka dots, all the little leopard spots. Yeah. That tells you she's highly estrogenic. That's why she's developing so many blood vessels, as you can see the lines and the little spots over there. That's what estrogen looks like. If somebody's an estrogen or Premarin especially, which is super estrogen, or high estrogen, and they're not getting progesterone, for example, not balanced. They're very estrogenic, and this estrogen dominance, and that's what they will look like. You take the estrogen away, and suddenly that one that you're looking at, the dark 4, becomes like the light 4. It starts to look much nicer, just because you took away the estrogen.
Yeah. So now this is so imagine, you guys, this is so powerful, right? To see this, where these changes already are happening years before breast cancer sets in. And that's the kind of stuff that a mammogram is not going to show you. And that's what we're trying to say here. It's not good or bad. It's just, it's a different purpose. And, you know, if the lady with number 4 goes for a mammogram, probably nothing is going to show up, right, on a mammogram. But it's that, and that is that. But when you do a thermogram, that's when it's the yellow flag goes up and going, and that's when you can do something about it. That's when you can start looking at changing your diet, looking at balancing your hormones, bringing in progesterone, reducing your estrogen dominance, sleep better, divorce your husband, you know, whatever, reduce toxins in your life, right? All of that stuff is preventable. And that's what I'm so passionate about doing this call with Dr. Rind and this education. So this is not a polarizing conversation. This is just really to help you understand the differences between the two. I hope this is helpful. By the way, for those of you who have friends who have breast just challenges in general, tag them in this video, and then they're going to be notified to watch that later. Dr. Rind, sorry, go ahead.
Yeah, and the bottom 5, the very bottom 5 grayscale, which, by the way, you can't see this if you don't do grayscales. The bottom one, take a look at how many dots there are. There's a lot of polka dots everywhere. And this woman was taking Premarin. She developed cancer in the left breast, where you see the hot spot, the red. But that's typical of what I see when they're taking that. This is the type of estrogenic pattern I see. It's a little more aggressive than the dark number 4 that you're looking at.
All right, let's move on.
This is not my patient. I would never allow it to go that far. She came to this thermographer, and the first one, baseline, is just a little spot of red. And he said, you know what, why don't you go to get a mammogram? Well, she did, and the mammogram was negative. So they said, come back in 3 months. Oops, the spot is bigger. Go get a mammogram. Oh, it's negative. Come back in 3 months. At 6 months, bigger red spot. Go get a mammogram. Negative. By 9 months, the gynecologist was already upset, didn't want to give any more prescriptions for a mammogram, but she managed to get it up. It was negative again. At 12 months, it was big enough. She said, I don't care. I just want to have that mammogram again. Did the mammogram at 12 months. That's when the cancer showed up on the mammogram.
All right.
But she could have done something 1 year before that.
Yeah. Yeah. And that is the whole takeaway here, you guys. That's the gold.
And here is the opposite. This is a patient came to see me, and she was from New York, love canal, toxic, and she had a breast cancer. Actually, she had a lumpectomy, and this is the residual, and it was a lot of little hot areas, as you can see. The cancer actually decided to stay there and spread. And she said, I would like to try a detoxification. I said, well, let's try vitamin C as detoxification. Just see if it helps you. So I did day 1. You see all the way on the left, day 1, baseline, it says. And and after that, she went home. I did a very high dose for the whole day. So it's really washed her out a lot. Next morning, she comes in, she says, can we do a thermogram just to see if it did anything? I said, sure. We did it. I was shocked. The next one, 81408. You see that? And it was much, much less. So we did it again. She said, can I do another vitamin C the same? I said, yeah, we did it. Next day, we did another thermogram. Take a look at what it looks like. 81508. It looks pretty clean. She said, can I do another vitamin C? Yes. Next day, looked the same, vitamin C. So we had 5 days in a row of treatment, and she looked the same as on day 3. Then 1 year later, as you can see all the way on the right, she came back for just more treatment, and that's her thermogram 1 year later. Absolutely no change. She was fine.
Yeah, that's amazing. So, I love stories like that, you know?
Yeah, but it helps to monitor whether therapy is working or not.
Yeah, yeah.
Okay, moving. Here's another one. This lady had you see with a big red spot over there? The cancer was actually right around there, and the mammogram missed it completely because it wasn't in the breast. It was right outside of the plate area where the breast would capture it.
Totally.
And in her case, I gave her some therapy that I was hoping would help, and I didn't know, but we measured with thermograms, and this is over a 4-month period, and you could see the big red spot on the upper one disappearing and continued to disappear at the end.
And what did you do? What did you do with this patient? Do you remember?
I don't remember what I gave her, but I gave her some of the supplements that are supposed to help with cancers. And the bottom line, though, is it's sad because she was told she needs radical surgery, including, I don't know where, spine, because they thought they had metastases and so on. And she brought these images to the gynecologist that was determining what to do, radical surgery. And he threw them in her face and he said, I don't believe in that stuff. So she said to me, what should I do? Should I have the radical surgery or should I just continue what you're doing? And I said, I can't tell you. I'm just in a supporting role. You do whatever you decide to do. Well, she decided to go with the aggressive surgery. That was her decision. I can't do anything about that, and I don't want to advise people. Here's another one this time I used poly-MVA, which was something I wanted to try with this patient. And this is what it looks like.
Can you explain what poly-MVA is?
Not really. I forgot. This is 10 years ago. And it was something that was being used to help with cancers and make the cancer more susceptible to your immune system. But that's all I remember about it. I haven't used it for 10 years, at least 10 years.
Okay, so what about this slide?
This slide just shows you that she was responding well to it.
Right. Okay, and that's you can see that all on a thermogram. Okay, so let's talk about this one here. This is a great part of the presentation. What is better than a cure for cancer?
And that's basically it.
Not getting enough.
Yeah. Prevention is the best, Unfortunately, we believe in correction rather than prevention.
Yeah.
And of course, the money is in correction, not in prevention.
Yeah.
Estrogen dominance is, estrogen is a stimulant, progesterone is a calmer. And when the two are off balance, it's sort of like estrogen is the accelerator pedal in a car, progesterone is the brakes, and they both have to be balanced to have a safe ride. If one is too high, if the accelerator is too high or the brakes are too low, the progesterone too low, we have estrogen dominance, and that's too much excitation for cells. This is an example of estrogen dominance. Before, top is before. After is after I give her a little treatment, and we got rid of some of the estrogen dominance, and you could see that. I think it's, I'm not sure, I can't read the date on it, but I think this is like a 1 month later or 2 weeks later. But sometimes you could see that in a few days. Let's keep going.
So when you say you gave her a treatment, like what kind of treatment?
In her case, this is strange, okay? The first thing I needed to do was, of course, make sure that she wasn't getting anything estrogenic from the outside, give her a little progesterone. But it turned out that the main thing that helped her was she had parasites. And when we got rid of the parasites, almost overnight, the estrogen dominance disappeared.
That's fascinating. That is so fascinating.
It was unexpected for me, but it just happened. Here's an interesting thing. Just like you have extravascular dilatation in the body, you have it everywhere, including your tongue, and you can see the little red dots. Look in the mirror when you're at your most estrogenic, look at your tongue. When you're at your least estrogenic, such as after a period, you look at your tongue and it'll look like the one without the arrows on the right.
So it's the little red spots, right, that you see women.
The little red spots are indicators of estrogen, and you have more of those when you're estrogenic, and you have less of them when you're less estrogenic.
Yeah, that is so. I bet you, like, everybody now is just running to the bathroom to look at their tongue as you're doing this.
Run in a few minutes when we're done. Okay.
So just heads up, you guys. We lost some by uploading the slides. We lost some images, but if you could just explain this.
I'll just explain to you. Okay, so there was a before and after image, and she had the blood vessels, and after the coffee, there was a whole lot more blood vessels because it has a promoted estrogenic effect. And so with this lady, one of the things that I did, we usually, again, every normal thermogram that you do is supposed to have what's called a cold challenge, where you stick your hands and put a glove on, you put your hands in cold water, and the chill for the body tells all the healthy blood vessels to contract, so the vessels start to contract and cool. However, cancer vessels don't listen to the brain. They belong to cancer. Those vessels not only don't constrict, they will very often feel that extra surge of blood and they will dilate. So they become warmer while everybody else becomes cooler. That sort of smokes out the unhealthy vessels. And very often you could tell that there's a cancer there just by that response. It's not always 100%, but it's definitely a nice tool to have. So sometimes I have women that don't do anything with a cold challenge, and I suspect that they have a cancer anyway. And this is a test I developed, and that is I give them a cup of coffee to drink, and then I repeat a half hour later, I repeat the thermogram, the grayscale, and even the color too, because you want to measure the temperatures. Another thing, if you ever go to somebody that's not measuring the exact temperatures throughout the breasts, they don't circle or whatever, the areas of interest, you're not going to a thermographer. I don't care what they want to call themselves. Next, so the nipple temperature rose and everything got worse. And I told her, okay, we have to look over here. There's a problem right here, because one area became hot and the others didn't. And in fact, she did have a cancer over there. But it was so early. By smoking it out, it was so early that she just got rid of it very quickly, easily, no problems. She's never had a problem with it since. Next, this over here, this lady came in with a lump in her breast, the where it says with lump, W lump, and that's it was in the if you look at the nipple in the left breast, it was approximately 8 o'clock and about halfway between the end of the breast and the nipple. Somehow my images didn't show up on this. So there was a big lump. It was like an egg. And she did not want to have surgery. She did not want to go conventional. And I said, it looks pretty bad. I said, it's very highly suspicious. And she said, give me something to do, and let's see if that doesn't work, then we'll think about it. I said, if this doesn't work, you're going to do something like a mammogram and whatever else we need to do or you need to do. So she said, okay, it's a deal. So I gave her the lymphatic massage that I showed before, and changed her diet, changed her supplements, gave her all the supportive stuff. 1 month later, she came in, and the thermogram looked a whole lot better, and there was no more lump. 4 months later, the thermogram is still improving and no lump. And I've seen this woman. This was about, I don't know what year this was, maybe about 12 or 13 years ago.
Yeah.
And I've seen this lady several times since then, and she's never had a problem with it since.
That's amazing.
So
hey, you guys, there's questions coming in. We will get to Q&A shortly. So just hang in there, and then we'll do all the questions together.
Okay.
Okay.
Going.
Next.
Oh, okay. Wait. Can you go back one?
Yeah.
Okay. You see the green line under the breasts?
Mm-hmm.
That's to show that they were at the same level. However, the next green line, 4 months later, because she did a lot of lymphatic drainage, the breast was actually smaller, and you could see it's higher than the green line. Okay, moving forward.
So we talked about the lymphatic drainage already, right? Should we move on?
And these were images to show you before and after. We'll have others. This didn't show up over here. I'm sorry. Okay, next. Following our observations. Can't do that. Next.
Yeah.
Next.
We lost.
Okay. We lost it. I'm sorry. I apologize. That's okay. The following are examples of restoration, physiologic, and balance of the rib function. Go ahead. So the ribs are very important because they help the lymphatics drain. Every time you breathe, in, out. So this is like a pump where the vessels go through the lymphatics, and it's a pump, and it helps. If your ribs are not moving well, then you don't pump out. So what I did with this lady right here is the color and the grayscale. Before, on the left, you could see big congestion areas, and after I osteopathically adjusted her rib cage and got the ribs to move well, and I didn't even do the lymphatic drainage, with the nothing, just ribs. And 25 minutes later, you could see that it is much clearer, less congestion. Everything looks healthier.
I think this is one of your superpowers, the fact that you are an osteopathic doctor, and you can do those adjustments. It's something that a lot of people are not able to do. So by the way, you guys, Dr. Rind is in private practice still. And when I say still, because a lot of people move away from private practice, unfortunately, and go online or go virtual, or, do telemedicine only or whatever. And so it's a rare opportunity. Like if you're on the East Coast, he's in Maryland, and still takes patients. And so it might be a good opportunity to pay him a visit, especially when you're struggling with stuff like, I have definitely things like that when one of my ribs is higher than the other. And I always have like a little red spot that shows up here, orange spot that shows up here. So I think the next time I'm going to be on the East Coast, I need to come and get an adjustment with you just to release that.
Thank you. And also, just to make a correction, I'm licensed MD. I'm not licensed as an osteopath, although I have the full and beyond osteopathic training. But in order to give me the degree, the official degree, they said you have to sit in class basic science for 2 years. I said, I don't have the time to do that. I just went there for the knowledge. I really didn't care about the rest.
Yeah.
Continue.
Okay. All right. So can we take some questions? Is that okay, Dr. Rind?
Please.
So there's one question here from Mitch. She's asking, what's the best vitamin C to take? Because some are not absorbed properly and are synthetic. She's in the UK.
Oh my gosh. Okay. Yeah, I can't speak to that as well as I would like. I could tell you that the naturals, the most natural, are the best. Yes, and they come with all kinds of bioflavonoids and everything when you get it all together. And if you don't have that option, then what you do is I happen to like slow release vitamin C because it sort of gives you an umbrella for the whole day, So
what about vitamin C IVs?
I use those a lot, and first of all, the vitamin C I use is a non-corn base, but it's they're very good, but they're just it's like a wham bang, you got it, and that's it. If you need a boost for your immune system, you need something big, you do it like that. I use it also for detoxifying. I found that when people have heavy metal toxicity, other chemical toxicities, it'll go out. I had one fellow that came to me with Agent Orange after Vietnam. He had MS, diagnosed as MS. I gave him a full blast of vitamin C IV. He got up off the thing, off the chair, and he was fine. He walked. It was 8 hours of IV, high dose, 50 grams or more, and he got off the chair. He didn't have any problem after that because we flushed out the toxin from him.
Dr. Rind, let's talk about, I want to talk a little bit about, what is a reliable thermogram? Because thermography, I think, because of a few bad apples in the marketplace, in the community, have created a bad reputation and have been, like there are some people Googling and saying like how FDA is warning people against thermography and all that kind of stuff, right?
That's not true. No, it's approved by the FDA. I'm sorry?
So that's okay. I mean, there's always going to be some argument for and against things, but I just want to maybe refocus us on asking the question of what is a reliable thermography center. Not everybody's going to be able to come and see you in Maryland, right?
Yeah.
People are going to be around the world. Can you just give us some pointers? We already talked about it, that, for example, somebody who does black and white versus color is going to be one of your one of the things you want to, guys, you just want to pick up the phone, call, and ask them what they offer. It's really as simple as that, right? So one is black and white versus color. What else?
Grayscale. Okay, color and grayscale. They have to be able to measure the temperatures and compare. Otherwise, they cannot give you a risk rating because there's an international standard.
Yep.
Another is they have to be doing a cold challenge. If they
Tell
don't
us
do the
about that. What does that mean?
It means you stick your hand, you put on thin gloves, you put your hands in icy water, in cold water, like 50 degrees, for a minute, and then you take it out. And if you can't do that for some reason, there are other ways. If the hands are arthritic, you could put a little ice pack on the tummy. The point is, you give a reflex for the body to chill, and then you repeat the images and the color scale, and you measure the temperatures, and you see if there's a reduction, which is supposed to be, that's good. If one of the areas heats up while the rest are cooling, you gotta go do something about it, because there's very high chance.
What about room temperature? Like you walk into a thermography room, that room should be at a certain temperature, like
72 degrees,
that, right?
72 degrees and or 68, up to, and it has to be temperature calibrated. We always have a thermometer over there to see what the temperature is, and the best way to know, and I'm going to give you a source website, the AAT, American Academy of Thermology, AAT. The American Academy of Thermology has the best standards. The guy that heads it is very, very specific. He's anal retentive. He's like, everything's got to be perfect. So he made sure that he sticks to the highest standards in the world. Not in this country, in the world. He maintains the highest standards. You go to the AAT website, and you're going to be able to find not only what required, which I mostly mentioned right now. However, also you will find people that are doing it that hopefully are the top because they're using it according to those standards. Like Gay Walden, you mentioned what?
So they follow the AAT or are certified by
guidelines.
AAT.
Those guidelines. And frankly, I don't know how you could call yourself a thermographer if you don't do the cold challenge, if you don't temperature calibrate, if you don't do a grayscale, if you don't measure the temperatures individually, and if you don't give a properly measured risk level, TH1. Thermographic risk level 1, 2, 3, 4, 5, and there are international standards for how you determine what that level is. If somebody's not doing all of that, then don't even bother.
Yeah, and then the other thing is also camera resolution, right? People gotta have, like, the center has to have a camera resolution, and it's on my blog post. I'm gonna pop in the URL here in just a second, because unless, do you remember the resolution or not really?
I don't remember it offhand. By the way, the other. There's a company or these other people that are doing it that are an embarrassment to the industry, and they don't do any of these things, and they give you a rating, and I read the reports, and they just don't even make any sense, and I have no idea who's writing those things. It's embarrassing, but the point is that 95% of all thermographers in the country are from that whatever.
Oh, really?
Company. Yeah,
Wow.
from those machines. And I constantly have people coming into me. For example, I had one coming a few weeks ago that she showed me she said, I don't need a thermogram. I just had one. And I looked, it was one of those. I don't want to mention the name because I'm going to get lawsuits. But I looked at it. It was just color images, and the resolution was reasonably okay. But none of the things I mentioned took place. So I
Yeah.
tried to figure out, and I looked, and it just looked a little suspicious to me, but you couldn't tell. So I said, let's do a proper one again. And she said, I'm not, and I said, I'm not trying to take your money. I don't have anything I can tell you from this one. So she did it, and it turned out she was a level 5. I did an exam, level 5. There was a lump. She had cancer. They completely missed it. She had a risk rating of normal.
Yeah,
Normal.
you see, those are the kind of places which give thermography a bad name, right?
Yeah.
One of the things I've also noticed is that if you're walking into a center that is offering a Botox, a facelift, a chemical thing, a chemical peel, and by the way, you can get your boob scanned, right? Run from these kind of places. Most of the time, they are not specialized in that. What I have found is that I've got thermography done in 3 different places, and every time, one's in New York, one with Gay in North Carolina when I was traveling through last year summer, and then one here in Boulder in Colorado. When you visit their websites, you could see like those are people who are truly passionate about thermography. They show you the before and afters. They talk about the resolution. They talk about how they prepare you. There's a whole preparation process. It's not just like walking in, it's like you get a Botox and you get a boob scan. Like it's not gonna be helpful in any way for you to draw something that is really conclusive. So, Dr. Rind, the question is, where are you in Maryland exactly?
In Gaithersburg, right near Rockville.
Okay.
Near DC, 20 minutes from Washington, DC.
Thank you, Shelly. Shelly just looked him up. Is drrind.com is the website. You can check him out there. And I was also asking, are thermograms covered by insurance?
No, I rarely find that any preventive treatments or approaches are covered by insurance. They wait for you to get something bad, and then they say, okay, now we'll cover this much.
Yeah, there's no insurance companies that actually cover prevention, so which is kind of and then Lisa is saying, so caffeine increases estrogen. I just want to qualify. Go ahead. Yeah. Okay, you go first.
Not in all patients. I find that some women, when I do the thermogram, they drink the coffee, they actually look better. So no, it's not a blanket thing.
Yeah, I think it's how you metabolize caffeine partly. Potentially that's, and also just want to clarify this because it's nuanced, but it's important. There's nothing wrong with something increasing your estrogen, right? Like for example, if you do something like flaxseed, that can increase your estrogen, and that's a good thing. Estrogen is a good thing. What we are talking here about is the caffeine or coffee specifically. I find coffee is particularly problematic, can increase estrogen dominance and not just estrogen on its own. So that's an important distinction here. Okay. And so what else? Can you just maybe share with us, like, what do you see in women, like when you do their health histories, what do you see are the major causes of breast changes developing in women, like before they come and see you? Like, what are the major contributing factors?
You could probably speak to that better than I can because, diet is important, what medications they're taking, or they're taking estrogen, things like that. If their diet is bad, if it's not an organic diet, it's already like, okay, they're in a different category. Now, it's because they're putting in xenoestrogens and toxins into their body. I look also for a history of trauma, trauma to the breast, trauma to, I have one lady, a horse bit her over here, and it caused a little swelling in the area. But remember what I said about like with the compression, when you have the swelling and you have poor lymphatic drainage, it took a life of its own. And eventually that became a cancer because the swelling was not draining. And when it's not draining, the area becomes toxic. And when it's toxic, it becomes more swollen. It's a vicious cycle. And it just never quite, all she would have had to do was take the quercetin and do the lymphatic lovingly, gently. And to remind everybody, when you do the lymphatic drainage, it's a moment to focus on this, not your shopping or something else. It's a moment to focus on your health and to have the consciousness, I am increasing my health. I'm taking away the bad stuff and allowing the good stuff to come in. And I'm becoming healthier for this. This is becoming healthier. This is a moment to dedicate to this part of your body to consciously know that you're restoring health. When we
Just being very
consciously know,
mindful, being very
yes,
mindful in
yes,
doing
and
it.
when we know that, it's almost like guided imagery. It actually helps to manifest that. It becomes a self-fulfilling prophecy
Yeah.
in
You
other
know,
ways.
one of the things I love about your massage technique is the fact that I think as women, we've been conditioned to touch our breasts to look for trouble. You know, it's like, oh, I look for that lump, you know, check for lumps, right? Like they teach you how to do all of that. Okay. I'm not saying that's a bad thing. It's you just, you know, you can do that too. But what I love about your technique is that, and the whole philosophy of it, is that you do it as a self-care, not because as a gift of love and self-care for oneself versus only looking for trouble. And there's a big shift in thinking about that, especially when you're so mindful, like the way you're describing. Yeah.
There is something to say. Yeah, I tell women, this is how you shower. From now on, this is how you apply the soap. That's it.
Yes.
But be mindful when you apply the soap. The other thing is this: you've seen the images with all these vessels going everywhere, all that stuff. And I had one woman; it's all over the place, vessels. And when she came in the next time, I looked, and there's vessels over here, and it's like a straight line, and below that straight line, there was no vessels at all. I said to her, "Are you doing the lymphatic massage?" She said, "Yeah." I said, "Please show me how you do it." She said, "Oh, the way you taught me, like this." So I said, "I didn't teach you that way," and I showed her the right way, to follow the spokes of the wheel. Anyway, okay, I'm sorry.
Yeah. No, it's all good. So we've
I
got.
have something. Go ahead.
Go ahead.
I just wanted one thing to say, because you said that there are a lot of detractors that say that thermography is no good. These are talking heads that don't know what they're talking about. They really, it's embarrassing. I'll give you an example. They tell you, well, it can't show you the cancer. That's right. You want to wait until the cancer is there? Wait, get the mammogram. The thing is, it doesn't. Now, if there is a cancer, it'll show you risk indicators. For example, I may not be able to see the smoke, the fire in the building, but I could see the smoke.
Yeah.
So the skin, the vessels on the surface, actually tells you a tremendous amount about, it's reflecting what's going on inside. You don't have to see the inside directly.
Can you just maybe talk just super briefly about why the areas that are coming up red, why are they red on the thermogram?
All the thermography machine does is give you an image made by heat. All it's doing is measuring heat. There are some areas where heat is normal, at the base of the neck, right here where it's captured. The armpit captures a lot of heat. Under the breasts captures a lot of heat. On the breast, you shouldn't have that kind of stuff. And if there's heat in the breast, it usually means there's a lot of metabolic activity or a lot of circulation, blood circulating near the surface. Either way, if it's here but not here, then it's not good. You should have symmetry. One of the main things we look for in a thermography is symmetry. When something is going on here that's not going on over here, the absence of symmetry raises our suspicion. Why?
And cancer kind of has its own lymphatic and blood supply system to the
creates
tissue,
its own
correct?
supply, which gives you a lot of redness or heat in the area. And it's not about red, because you could turn the scale on the thermogram machine down so that this would be green instead of red, but everything else would look black. So we adjust it to make it visible.
Yeah.
But when the rest of the breast would be blue, for example, and this one is red, that's red lights, sirens, forget it, gangway, we got to do something. And if it's just a little bit of red, but the next time you do the thermogram, it's more red, you better do something about it now before it becomes big enough to be a problem or a bigger problem.
Yeah. So let's take one more question, you guys, before we wrap up. And I was asking, so do you recommend to stop drinking coffee if I have fibrocystic breast? Dr. Rind, what's your take on that?
Again, some women respond poorly. Some women respond very well with drinking coffee. You could stop the coffee and always see if it changes. But if you want to get rid of the fibrocystic breast problem, do the lymphatic massage and use the Happy Sisters cream, which is the same formula I basically use roughly. And if you do that, when I do that, usually the proper lymphatic and put on these, the poke root and so on, then Usually within 2 weeks, women tell me that they're no longer lumpy. And
Right.
that's very fast, lightning fast. Before you go to the doctor, you do that, and then they say, "Oh, there's nothing here. That's great." Now, the other thing is, yeah, go ahead.
We have a good question here. I wanna just take two more questions. Anna says, "What if the area of the thyroid shows red?"
It's usually in this area it's red, but if you see just one area of the thyroid and the other one is cool, you may want to check that thyroid out. There may be something going on there, but it could be some infection or lymphatic problem too. But still, the difference in heat is a sign of something is not equal here and here, and then you want to know why. You really do want to know.
She just posted saying that she has Hashimoto's. So
yeah,
but if
you have Hashimoto's is normally, because it's an autoimmune, it's systemic, it should be bilateral. A tip for the future. If it's systemic, it's usually bilateral. If it's unilateral, it's usually something structural. That means, you broke a bone over here. This area is different than this area. If you have a cancer, one hair, but not over there, there's asymmetry. So I call those structural problems. But if it's autoimmune, you don't expect to have, I have a reaction in this hand, but not in this hand. If that's the case, you probably have something else going on.
Yeah, let's do one more. This is a good one. Dana is asking, what's your take on ultrasounds?
I use them all the time. They're non-invasive, and sometimes they give you some very valuable information. Sometimes I use it just to make sure that the lump is shrinking in case I'm following somebody, and we could see the volume. Another thing about ultrasounds, which you haven't heard about, and it's very sad for me, is elastography. Elastography is a special kind of ultrasound that beams in two different frequencies. So the harder material of a cancer will reflect differently than the soft material and of a benign lump. And so you see the density. It shows you the density of the structure. And there's a certain density that rises above where any normal tissue would be. In other words, you have normal tissue, could get dense. The next one is bone. If you're in between those two, you're probably looking at a cancer, and they've done studies on them, and they're extremely accurate in telling you that it is a cancer or it isn't a cancer. And I suspect that is why they're not popular. But
so would you say that ultrasound would not show you is not as effective of an early detection tool as a thermogram would?
Thermogram, in my experience, is 10 times more accurate, more effective, because you could look at there are many benign lumps. I do this all the time. I give them the treatment, the lump goes away. Suddenly the ultrasound doesn't see it anymore. So what were you going to do? Were you going to do some kind of a biopsy or some other treatment? No. Make sure that it's okay. When you do a thermography, and if there's no heat over the lump, there's statistically about a 99% chance that it is benign, that is not cancerous.
Yeah. So
if there is any heat, you better be careful.
Shelly, this is for you, Dr. Rind. Look at that. Thank you, Dr. Rind. Excellent presentation. Hello from Shelly Asper, now Ross, an old patient, now living on the West Coast, but hope to see you again before too long.
Thank you.
Awesome.
Thank you.
Well, thank you so much, Dr. Rind. Thank you, everybody, for your excellent questions, for your participation. And I think you guys, I'm assuming you're pretty open-minded, since we did not get anybody dissing thermography here. Coming in with an open mind and open heart to listen to all of this. I think education is everything. My suggestion would be get a thermogram at least once a year. If you're having challenges and things were not looking too clear, then more often work with somebody who really knows what they're doing. And I hope today's presentation, you got a lot more empowerment of what is a responsible, high quality thermogram, thermographer, or thermography center, what to look for, what questions to ask. And if you are in the Maryland or East Coast area, or you're wanting to fly in, please do go and see Dr. Rind. I think his magic goes beyond just doing thermography. It's much more holistic, comprehensive, but also the fact that he can do adjustments. I think it's very unusual, as most places do not do that. So very special in that way. Well, thanks everyone for being here today. And thank you, Dr. Rind, for making the time for us today from your busy day. And I will see you guys next week, where we're going to be wrapping up and talking a little bit more about, does estrogen cause cancer, and expect some guests as well talking about that. Thanks, everyone, and have a wonderful weekend. Bye-bye.
Thank you.